My name is Jennifer Montgomery, and I happily serve as part of the Information Health Technologies team, and I'm very honored to speak to you today of our hopes for the future of a universal electronic health record. Imagine the new reality of a health record that can be accessed by any provider at any healthcare facility in order to see a more complete picture when treating a patient. I've only recently joined the IHT team. I'm an ER nurse by trade, which has helped me recognize the value of a universal electronic health record. As an ER nurse, I learned that sometimes a patient can be their own worst enemy. My own father is the perfect example of this. 2 years ago, my dad was complaining of some very intense upper abdominal pain, and it sounded very typical of gallbladder attacks. But, of course, the daughter doesn't know medicine, and my dad insisted, "I don't have a gallbladder. It was taken out with my appendix years ago." He contacted his primary care doctor. Oh, it gets better. He contacted his primary care for help, and thinking the issue was constipation, was given mag citrate and told to wait. Well, he waited, and he waited. And then the mag citrate kicked in and all the waiting was over. The pain went away, but then returned a few days later, even worse. So he called his primary again, sent him to the ER, abdominal pain, nothing weird about it, so they did a bowel series, and he was sent home with stool softeners and a diagnosis of gastritis. A week later, my dad just wasn't right. And my dad is a man's man. This guy's been hit by a train, his right arm has been left hanging by a piece of skin, and he's all right. So we knew something was wrong. So back to the ER we went. This time, an abdominal CT showed the source of the problem, Dad's gallbladder. His gallbladder was never removed until that day. If we had had a universal electronic health record, then all of those multiple physicians who had seen him and the radiologists who had access to his record would have known that that was his problem in the first case. We would have had a reliable and documented health history of the systems and organs. In the ER, I've also seen countless patients come through the doors who can't share their medical history because they're either unconscious or incoherent. The silence of an unconscious patient creates a large informational gap when medical staff are trying to save a patient. And if family does arrive, they are usually very distraught, and they don't have the clarity of mind to offer very much useful information. When my daughter was 8, I witnessed her having a seizure at home. And now I've seen several seizures in my years as an ER nurse, and I know that what to do when a patient has a seizure, and many seizures are benign, but this was different. This was my baby. My nurse brain tried to take over, but it lost out to my mom's heart. All of my nurse knowledge disappeared, and I knelt beside my baby, feeling just as lost and distraught as any parent of any patient. It changed my perspective on family members. If I, a trained ER nurse with nerves of steel, couldn't think clearly in a moment like this, how can I expect an average mom to do so? A universal electronic record can bring the informational gap created by the emotional paralysis brought on by seeing a loved one can bridge the informational gap created by the emotional paralysis brought on by seeing a loved one that is ill or in pain. It is my sincere hope that our work with the electronic health record will serve our frontline clinicians in times when patients are poor medical historians, just like my dad, or families are distraught like I was. A universal electronic health record gives us the opportunity to aid the healthcare provider in seeing a complete picture of the patient they are treating, not just the pieces of the picture that the patient allows us to see.